This is part of a series that we're running at the Myanmar Institute of Directors. A few of you are already members, so welcome members. If you're not a member, please join. We are a group of mainly company directors, but also of business leaders and those professionals who are looking to keep upskilling and keep moving into the world of corporate leadership as well as governance. And we exist really to help the directors, and we also exist to improve corporate governance standards in our country, in Myanmar. It's a community, it's a membership-based organization, but we do have affiliations with regulators as well. So we're a great platform for you to channel your practical experiences that you're having in your business day-to-day world to the regulators who come up with the rules and regulations that we all have to abide by. So please join. So as I was mentioning, this is a series of presentations that we've been trying to run since both the global health crisis and the political situation in the country. And Magdalena will I'll leave you to talk more about yourself as well as Metis, but Magdalena came through Authris, which is an organization based in the UK, and we don't have them on board, but they were presenting a few weeks ago on something a little bit similar. And given the situation, we've just been doing a bit of a series on leading organizations through crises and also on mental health, because we find that all of us have been facing challenges in those areas. We'll keep this really casual. I believe, Magdalena, you've got a presentation, and then there'll be room for Q&A. Please use the Zoom functions for in the chat for Q&A, or just raise a hand. And I'll leave it to you, Magdalena, on how you want to manage it, whether you want to take questions at the end or whether you want to answer them as you go along. But really, over to you, and welcome again to everyone.
Well, thank you very much. I'm delighted to be here and to be able to share some of the lessons learned that we have had facing the pandemic in Sweden. And that's where I will be basing today's little talk on. I hope that the internet and the weather will be with us so that we can keep this. I don't see very many participants, and also I'm a little bit wary that I will see if somebody raises a hand or wants to ask a question. So please feel free to just join in with audio so that I don't lose track of any questions. Like Cherry said, I'm happy to do this very casually. I will really invite you to take this to heart. Maybe note down a few questions that you have for yourself to bring back to your organization, or for yourself or your family to talk about. I find that sometimes it's difficult to give yourself the space to reflect on these things. So hopefully this will be a little injection of that. And maybe also this is a time that you have carved out for yourself to do it. So I'm just inviting you to use it as you feel best. Also, I will be sharing some of these slides, or all of them, with you if you want. So if you feel like turning off the screen and going for a walk, or, you know, zooming out a little bit as well and just listening in, that's fine. Well, I do have a PowerPoint presentation, so I'm going to now click on my share screen and let's see if it works. All right, can I have a thumbs up? Are you seeing my brilliant? Okay, well, the topic of today is functional capacity, and I am hoping that I will give you some tools for maintaining functional capacity over time. That's the idea as well. And this is a concept that we developed in the spring of last year. We were at that time training mostly journalists and humanitarians on how to be able to effectively provide services under pressure in situations of catastrophe, conflict, or faced by threats to your person. We as Metis, we had just produced a handbook. We were publishing a handbook on field security, and we were working as advisors on this, especially training, hands-on training, on how to deal with these threats and challenges, and also very much about developing a safety culture, working with people. How do you as an organization and as individuals deal with this when it actually comes to practice? But the concept now of functional capacity is something that we have developed together with Niclas Wisén, and he was in spring 2020 in the end of writing up his PhD thesis on stress in extreme situations. And also he has developed methods and a screening tool that's an app actually as well for measuring psychosocial health and well-being. And he has also worked as a military psychologist, so he knows very much and has been following for decades people who have been abroad and then come back, people who have endured extreme pressure. And that gives him a bit of bulk, I can say, on how to see trends and analysis. So given the situation in 2020, we thought, well, hey, we need to join up, because we were separately outfitted with a different toolkit for how to prevent, but also give support during crisis. And it was not because it was a system that kicked in when we had the pandemic. It was by chance almost that these things came together. So we were contacted in March 2020 by the ICU, the intensive care unit at one of the hospitals in Stockholm. And they said, hey, we don't know what we're up against, but we're hearing really, really awful things. It's like a tsunami coming towards us of this invisible threat, the pandemic. And in this very difficult situation that the hospital was in, we found that it wasn't just a challenge of being better at leading. We had NATO standards. We had all kinds of structures. It wasn't just about being better and stronger at leading and organizing from crisis. And what Niclas was saying was that it wasn't just a matter of being better of screening and catching people as they fell through, because that's very much, those were the tools that we had. Prepare, better standards and leading at very high level, and individual support when people weren't able to deal anymore with the situation. But at a hospital, that didn't work. And at the ICU clinic, where the people were coming in, the ones who were most sick, there isn't enough staff to allow them to burn out. They weren't being helped by better leadership and organization because there was nothing to lead. There weren't going to be more resources coming in because of that, because there just weren't any. We didn't have the stocks, and we don't have ICU doctors and nurses in some kind of warehouse that we can bring out when we need more. So we needed a different way of organizing ourselves. We needed different concepts to kick in now, so that we could also prevent this from happening. So we decided to combine our different toolkits, and we have centered on functional capacity and maintaining it. And that is pretty much the toolkit that we are still working with now that we have also, in the last year and a half, employed them. We are still finding that this toolkit gives us lessons and tools to also refuel. So this is the picture of what it looked like when we were working with our doctors. And I think one important first thing is that in order to enable an individual to manage stress in a difficult situation, the leader needs to work on giving the individual an understanding of the situation. We need to understand where we are in order to give ourselves the capacity to handle. And hospitals, especially intensive care units, you can hear it from the name, they're very good at what's intense. They're very good at working with a point in time. That's how they are dimensioned, that's how they work. We can huddle resources and we can deal with something that's an incident. But very soon we understood that the pandemic that we were seeing, it wasn't just going to be a point in time. It wasn't going to be like a bus crash, for example, where you can work really hard for maybe a week. Maybe you have after 2 weeks that most people have left the intensive care unit. When we looked at this point, it turned out that it wasn't a point. It was just a really, really long timeline. It continued. We didn't know where it was going to end. And that changed everything. And I'm hoping now that what I'm saying, I'm going to place it very firmly in the context of a Swedish hospital, but I believe that these are principles that we had to apply to this new situation for us. And these principles are equally transferable to other situations. So really what I'm hoping now is that you can find this comforting, maybe, that people in other places of the world are dealing with similar situations that you are facing. And also you can make use of these principles for your own organization and where you are. But this was the first thing. This wasn't just a point in time. This was a timeline. We had a prolonged situation that we were having to handle. So what do you do then? Well, being people that work in hospitals, we had to, first of all, build rapport. We needed to have an understanding. We came in from the side in a very special situation, but we did find that we could unite and build a language for this. Again, a language so that we could give individuals and also the organization a way to both understand and also communicate internally. So here we are, intensive care unit. We are quite good at dealing with the body when we have an emergency situation, when we have an accident, when we have incidents. We have a language for speaking about pain in the body, for example, for mapping that. But what we really need is to make sure that we don't miss out on also the mental aspects of this. We can't have a gap between them. And what we know from research and also from what's battle proven, if you like, what's been tested in difficult situations, is that endurance, your fighting power against this in this struggle, it really depends on both your mental and your physical ability to perform. You cannot have one only. You need to have both. And this is really where also Niclas' research comes in, and what we employed very early on is that we made sure that we could be mindful and even grade at what level we were able to perform. And this gave leaders in turn tools for monitoring and making informed decisions. So we had to find a word for this, and that was functional capacity. I really would like to ask you to think of similar examples where you do this at other times. Maybe some of you are runners. Maybe some of you do other kinds of sports. Maybe you have this kind of way of measuring functional capacity that you can employ in this situation to make it easy for you to employ this concept also now that you are dealing with a prolonged situation. We used this functional capacity concept at the ICU, because what they needed also was a word that they could find was suitable for their situation. It wasn't just that time, limited time that they were having to deal with. They needed a new concept also to grant them recognition that this was something new. They needed to employ new methods, a new way of also really minding both the physical and the mental aspects of this. And I'm going to try to be really hands-on now here, so you can look into this toolbox and pick from it yourselves. Again, also what we had to do when we were in this acute situation is that we had to very quickly implement these tools. We couldn't take a time out. We couldn't, have a nice break, take the whole organization, take them to a conference or at the training facility and introduce new ways of working. The train had already left the station. I think that's also important to say both to an organization and to yourself as a leader, and maybe as a trainer in crisis management as well. What's the situation you're working with? I mean, we already came into this a bit late. We weren't prepared for this particular situation. So we had to be, we had to give ourselves that understanding of the situation we were in. But we took these tools, we made them very tactical. And it all emanates from this model, demands and resources. Now, this isn't something that I think will contradict other trainings that you've had, because it very much comes down to the same thing. How long you will be able to keep running depends on whether you have the resources or not. It comes down to what demands are placed on you in the brown boxes and what resources you have at your disposal. And the job is, especially you as a leader, your job is to balance the demands and the resources and have an ability to look at what's the total. Where is the tipping point? You would ideally strive to have a positive balance so that you can take shifts. Now, balance, it doesn't come from theoretically just stacking things in nice little columns. Balancing, it's not something you just decide to have. It's just like endurance and other kinds of stress management, something that you have to train. It's an ability, and maintaining or creating a balance will take time, but it can be trained. So I'm hoping that's some comforting words for you. And we can understand this idea of demands and resources and also hopefully affect it as an individual as well as in organizational level. Maybe you can look at it as a transaction where you make a withdrawal sometimes when you have to perform, or when the situation places lots of demands on you. If you keep withdrawing, you're going to run out. So if you withdraw, you also have to, fill in. So we need to regulate. And this type of language, this kind of understanding that it actually is both possible to balance, but also requires you to manage this very mindfully. That is sort of the first building block. So what are your resources? Well, there are some principles here that are, I think, common to us all. We look at it, we can look at it in small building blocks here. One of the most important things is good leadership. And now that's easier said than done, right? But it's when it comes to this management of stress and the stress reducing leadership, we know that by the actions of a leader, you can influence this. As a leader, you can be stress reducing, because the research shows that what key individuals do, how they act, is very, very important for how the overall situation is understood. So good leadership is key. Also camaraderie, how your social relations is super important. I'm going to really dig into this a bit later as well. Sense of control is key, that you can at least control a few things. Your ability to impact, or your sense of ability that you can actually make a change, or that everything is, again, it's very closely linked to control, that you can make a difference. That is something that is a resource. That is something that will help you deal with the crisis. Clear information is super important. Now, usually a situation is murky. You have all kinds of barriers to giving clear information. But again, here, this is what you need to look at. This is what you need to assess. And again, keep track of what information can I give? What information is clear? What is not? Where is that balance? We're also going to look into mindset. That's something that is hugely important. Again, the dot or the line. If you're just waiting for things to go back to normal, or if you can actually have a mindset that this is tough, but we're going to get through it, that will really, really make a difference of what resources you can tap into. And then, of course, there's a whole lot of coping mechanisms and individual and group level ability to recharge, to, again, compensate for that withdrawal. Those are really the most important resources that you have. And again, I'd just like to say that your understanding of this might change. It might be very different within different cultures, of course, but also within different organizations. Organizations we are working with deal with this very differently. They look at this idea of demands and resources very, very differently, because sometimes a demand is understood as something hugely heavy, a burden. And some organizations, they have a different mindset and say, well, hey, that's not really a big problem. I mean, they sort of just take it. That is something that I think you as leaders also really need to have a think about. Sit down and look at, well, what are the resources? What is actually placing a demand? And is it equally heavy for everybody? Because we know that when an organization needs to work, we need all parts to be interacting. If there is one part of an organization that is feeling a very heavy demand and others are just sailing along, that will also create a tension. So your culture, your understanding of things, and also the climate in which individuals are able to talk about this hugely impacts the ability to lead and to handle stress. Do I have any questions on this? No? I'll carry on. Okay, so coupled now to resources for stress reducing leadership. Again, we went through them, but really what you need to be doing is looking at these principles: increase sense of control, trying to increase the sense of clarity, increase the ability to impact, and very actively employ coping mechanisms. Now, just a very short note on this. This is more of when dealing with acute stress situations, but since we are not we're not entirely protected from having to deal with them as well, I just want to share this as well, that when you are dealing with acute crisis in particular, when you run into them, it could be very important to know as a leader that it is extremely helpful for the individual, we're talking about the mind especially, to employ them, to give them an idea that they can actually do something. This is an example also of why control and clarity and ability to impact is so important. If something traumatic happens, if you can react by maybe guarding that gate, or you're given a task to collect a few statements or get blankets or organize information of somehow, if you activate the brain in that sense, the reason side of that part of your brain, that will help you cope a lot better. But if you, on the other hand, very quickly go into emotions, if you activate that part of your brain and only a bit later start dealing with things in a more, the reasonable way of handling things and doing tasks, that can have a more harmful effect on your brain. Again, this employs, especially in acute situations, but I think also for you as leaders, you will perhaps have to deal with them. And also, again, I think you can take this principle with you also when you are leading in the long term, because you will find that this principle of employing the idea of giving a sense of control, giving a sense of purpose, giving tasks that can be fulfilled, that will enable you to lead and not be just led by crisis. And also that will be a coping mechanism and helpful for the individuals in the organization and the situation. Now, it's very easy to be afraid when you are feeling stress, when you are in a situation where you feel that your heart is beating, your muscles are tensing, or when you have a cognitive reaction as well to stress. And you can be afraid of those feelings. One thing that we worked very much with the ICU personnel on was this. We made this picture into a dashboard, like driving a car. Because one thing that's also important to know is that it's not dangerous to occasionally make a withdrawal. So this stressor meter is meant to illustrate that. You want to be in the green zone, so to say, where things are fine and you are ready to take up a new task. But it's totally fine to also be in a situation where you have to react. The important thing here is that you need to go back. So again, this is builds on this resource demands model. But you as a leader, and also hopefully you can share this information with individuals, want to make sure that you are somewhere between these two. If you are in a situation where you cannot go back to green by resting, then you might have to be mindful of warning lights. This is where needs other leadership tools. It needs a different way of treating things. We say going into orange. This is also a scale that's used in other contexts. That means that you might have to, to continue with the metaphor, check the engine. You might require a bit more service. You will have to do some things differently. And also, if you're finding that this doesn't work, or if you, over a prolonged period of time, cannot come back down to normal levels, then you also need to seek perhaps professional help or change things a bit more. Again, this is a dashboard. This is a tool for measuring and also giving personnel, individuals, an ability to grade themselves, to measure where they are, and to also both acknowledge this is where I am, and as you know, that's a coping mechanism, and not also be too afraid of feeling an emotion. It's okay to feeling an emotion. You just need to name it and then also deal with it. And again, one of the key things to choosing now from this toolbox and these principles is to have a look at what situation are we in. Is it a sprint or is this the long haul? And when you are in a situation where you don't know for how long this is going to have to go on, well, you need to ask yourself, well, what can I do? How do I balance demands and resources when I don't know when it's going to be over? We we talked a lot about this because it can be very political. You can have very different analysis in an organization about where you are. But again, creating that sense of where am I? What is the situation is hugely important. And again, it was one of the major things, and this is still being very much talked about in Sweden, about, you know, whether we were dimensioned or not to the uncertainty. But again, the principle is to always try to balance. And we have heard it as a mantra from other contexts, right? Sleep when you can, eat when you can. I don't know, do you have an equivalent where you are? Perhaps, perhaps not, but this is something that we could use at least to teach the staff that don't wait for that time where you can recharge, but use the opportunity. Always try to create a positive balance if you can, or refill. Now, I've talked a lot about having a shared understanding of the situation. This shared consciousness is a concept that has been employed in various places. There might be different names for it, but this is the one that we also used. We talked about having a shared consciousness within the ICU clinic, especially. The unit where we were consisted of different professions. You had the staff, which they were treating the patients, nurses of different kinds. You had support teams for the medical technical apparatus that was needed. You had a small unit that usually don't have very high demands on them, that work with they sterilize basically the instruments used. They took a huge toll during the pandemic, because all of a sudden all the respiratory tubes and other things had to be sterilized because the system of just-in-time and supply chains weren't working, for example. All these groups were in different pipes. They weren't necessarily communicating, and they were very different in their understanding of the crisis. And also this happens easily, that the people on the ground, sort of a lower level staff, will not have the same understanding as leaders. So building and bridging this is absolutely crucial for just keeping the organization, the cohesion, the comradeship. And also as a leader, this is a tool for leading, because if you can have a shared consciousness, if you can build a joint understanding, then you will also be able to tap into a lot of resources. Shared consciousness, if we're going to define this, is a deep and shared knowledge of what the challenge is. And you need to create a narrative around this. What's the challenge? The second part is, what can it lead to? If you have completely different ideas of what the challenge is, or what could happen, you will be assessing every situation differently. And I don't think you need to imagine. I think you can reflect on examples from your own lives, what that creates. People will not understand directions in the same way if they have a different understanding here. So what we worked really hard on was creating a narrative on what is the challenge, what can it lead to, and what does it in fact demand of us to do in order to master the situation. Because now we were talking about moving into uncharted territory. We didn't know. There weren't guidelines on how to treat COVID patients. We even had different idea of whether it was a small thing or whether it was absolutely lethal and was going to wipe out an even larger part of the population. And the discrepancies and the media and all the buzz around this was huge. So we created a narrative around this. And when you achieve a state of shared consciousness, it's then that you can start to also enjoy things like a strengthened will and capacity to withstand the challenge. Again, that links back to mindset that we had as one of the resources. If you have a shared consciousness, if you're in this together and also feel that you know what's going on, you can employ a correct mindset for the situation. If you understand what the challenge is and you know what could happen and what it actually takes of us, you will also not be relying so much on having detailed instructions. You yourself know. So this is a way of leading by empowering execution. And especially in the hospital in Sweden, it is a very flat organization. I mean, this could be a Swedish thing, but I think even for Swedish standards, we were a bit taken back by it, really, because as they had to keep bringing in nurses and even untrained nurses to be, hands for nurses, we had an organization that grew at this particular ICU where instead of being around 100 persons, they grew fourfold. They had 400 people, but the staff could not grow. So imagine during the space of 3 weeks growing 400% in staff. And also when time was moving so quickly with the developments of medicine and not having access to supplies, not knowing what the medical expertise was saying about how to treat, we couldn't wait. We couldn't wait for a top down and then the normal way of relaying information. So we needed to instead have this shared consciousness and then take informed decisions in a different way. And also we needed to create a team of teams. So everybody felt that they were part of a larger team, but they were being able to operate on their own because they were running different shifts. But they needed still to have this feeling of being together. So shared consciousness is what you're striving towards, is a state of being, I guess you could say, but it's very practical and tactical as well. And the tools for this, well, they are to, first of all, manage information. You need to share information. You need to share a lot of information. What we said was we needed to marinate the organization in the right information, because this is also a battle of information. When you have uncertainty, you get lots of rumors. And we also had cases of malicious disinformation that we had to handle. So we needed to make sure that we own some of the channels for communicating. And by continuing with this narrative, we were creating a bit of clarity. We were creating or working towards, again, also maybe not leaving so much room for rumors and malicious talk. And I'm talking also very, hands-on what happens in some of the rooms, in some of the clinics, in some of the, whether we're changing clothes or having a coffee. Because that became an echo chamber of fear and disinformation. We also created, and that's very hands-on, a common operational picture. Maybe you've talked about this, maybe you're employing that where you are regularly. But again, we set up a room and boards, and also we had like TV screens where we were putting out the most important information and where people could go back to look at where are we in this. And also very much we worked on creating an operative rhythm. If you don't know how long you're going to be marching, at least you know during the day what some of the key points are. We created a rhythm for relaying information, for changing between the shifts. And that came right back to the principle of again, clarity of what's going to happen during the day, a bit of sense of control, a bit of an ability to impact what works with my schedule. We're talking about young people with families that needed to be, doing shifts that were, sometimes 14 hours. So giving them an ability to also impact a little bit on what the operative rhythm should be. And again, back to sharing information, we created a narrative and we created ways that were adapted for the hospital situation of extremely clear orders, extremely clear orders that we had the detail of information that we could share, but we also made sure that we wanted to make it easier for this large group of people to understand what was asked of them. And how we went about that was we really tried to train the leaders on not just saying what, but going also a step further of explaining why and why not something should be done or not be done. And I think that's something that we can always be better at. And it's something that we very easily forget or rush past when we are in a acute situation or during stress. Stress brings out some of our superpowers, but it also can make us socially not so responsive is, I guess, the political way of saying it. We become a little, we become very harsh sometimes, a bit squared, and we lose that sense of understanding and reading other people because there's too much going on, right? So really making sure training in explaining what, but also why and why not. Because by doing that, you are explaining what's the intent, what lies behind this decision. And when you do that, you also enable eventually people to understand what the reasoning was, so that if you as a leader isn't present, or if there's a new situation, in the best of worlds, and this is what we had to work with and create, people could say, well, hey, I haven't been in this situation before. I don't have anybody to ask because my hands are stuck literally into this body and everybody else is gone. And I'm wearing a mask and I cannot communicate. But what would, for example, Lars have done, the commander? And by thinking about, but what would he have done in a similar situation? Would he have continued with this kind of treatment or what have you? If you can have a bulk of experiences, if you have shared what your intention was with what you had ordered earlier, this is information that your staff or another person can use as a resource to themselves make decisions that goes in the direction that you have staked out. So implementation is everything, right? It's easy to find lots of stress reducing tools. We can go A to Z on it, but implementing is definitely a crucial part here. And again, my recommendation is not to bring in too many new things if you are in an acute situation. I mean, looking at the resource imbalance, we have to be looking towards ourselves as well. Do we manage another organizational change, or can we just lower these demands placed on us? So we want to limit too much of new upheaval. So implementation, we found, is hopefully finding these principles or routines or key people and things that we already do or have done in the past and building on that. And then more of, I think implementing is very much about stopping doing other things. But again, implementing shared consciousness for us was building on the principle of information sharing, of marinating the organization in the right information. And we worked on, again, establishing routines for using a common operating picture. routines for having and using the operations room. I think you saw the picture, and I'll bring back that picture again. We created a physical space where you could go. So if you wanted to know something, or if you wanted that little break, or if you wanted to relay information, you knew where to go. And also we really wanted to give that as a routine for tempo variations, really helping people go from different, very intense situations with a patient, or intense meetings and I guess arguments over certain things, meetings with relatives, for example, to having that place, that physical room where you could go and just when you were shifting from one physical place to another, also that gave you the chance to go sort of reduce your stress levels. You had a sort of a ritual, a way of triggering from now I am in full alert to I'm now in a safe zone. So that's one way that we worked on this. Again, handovers, different briefs, and tempo variations is something that we really, really worked hard on implementing and scaling away everything else, because we know that as a crisis happens, the longer it goes on, the more and more tasks the leaders have to fulfill, because you got to maintain your key chores and tasks, but you also have to handle the crisis. So the total really swells over. The other thing that we found that we needed to work on, especially at the ICU, and I can also add that we're not just doing this at one place, we're continuing with different hospitals at the moment, is that we had to have present leaders. We need each other. And the pandemic makes it very difficult for us to meet, but we had to show leaders also out bedside even, to be visible in the corridors. And a present leader, well, one way of getting that was, again, the narratives, having them available, making them easy to communicate. I mean, we have a game for kids where you whisper something into one person's ear, and then that person whispers to the next and to the next and to the next. And say if you are 10 people doing this, the last person says that little phrase or statement, and you compare it to what the first person said, and usually there's a huge discrepancy, and usually very funny. I mean, in a crisis, we get that, but it's maybe not so funny. But again, we are humans, and we are very human, and we need to acknowledge that, and we need to adapt to that. We need to look at this, I think, with a very clear mind, and not with too much guilt on being perfect, but having oversight of how difficult it is, or how maybe imperfect sometimes also our tools and our ability is. And again, the present leader, again, drill it down, continue to explain not just what needs to be done, or what the order is, or the goal is, but also why not. Some of the very tactical tools that we also used are these. We were in the beginning of the pandemic very, very much in a situation where staff were experiencing, for the first time ever in their lives, fear of their physical well-being. ICU staff, I mean, they take people in that have gunshot wounds. There are tense situations where there has been violence, for example, but very seldom do we have people in this kind of civilian context that are trained in dealing with feeling threatened at their person. So some of the tools that we used were, of course, breathing. This is just amazing on how, even if we don't believe it, so to say, we can impact our body. We can take breathing, which is a very normal thing to do in a normal situation, when it's not acute stress. And in situations where I have worked previous to the pandemic, for example, hostage situations and other things, we see that even then, even there in such totally extreme situations, breathing is key. It works. It works in the most acute situations, but it also works. It really works in these prolonged situations. So taking time to breathe. And what we needed was to just give the staff one tool to choose their own way of breathing. And we also employed what you can see in the bottom left here, Cooper's colors. We gave them a scale again of looking at how you can go from being very relaxed when you are feeling completely at ease, white, that's the white, to being in a zone of black almost, where you have been affected by so much stress that you are irrational. And just giving the staff an idea of going between these scales was important for them to recognize their own emotions and the effects of stress, but also for them to see that some of these reactions are adequate. If you are in a situation which is extremely dangerous or stressful, well, then it could be an adequate reaction. But the important thing is that you cannot stay in it for too long. So again, looking at, for example, very difficult situations medically where you, for example, intubate or take out the tube, that's where it's fine to be yellow, so to say, but you cannot continue. You cannot always be yellow. When you leave that patient's bedside, for example, you need to have that little ritual or little step where you also go down in stress. And that's where you can also use, for example, breathing to move out of it and to trigger yourself. If you can't breathe, for example, if you're sitting in a stressful situation, maybe it's not the time, right? We also introduced some other techniques of doing tactical relaxation of the jaw and the upper part of your chest, which is not visible, but we taught them how to trigger these things that are invisible, so to speak. One of the most important things that we used as a tool for the leaders of staff was to implement this idea of march, and rest. Again, this is something we used in sports and training. We know it's age old. Humanity has, understood that this is the way to go. If you are going to move over a long distance, you cannot just sprint, right? So, for example, when we do marches, say we are out climbing, or if the military knows this very well, when they needed to be moving, they walked for 50 minutes and then they took a rest for 10 minutes. They marched for 50 and they took a rest for 10. And one of the important points of this march rest concept, it is that you do not do it because you feel like you have to rest at that part. You're not and this is the key. This is something that is ordered. It's up to a leader to pace this and to ensure that you make it into a habit, into a routine to actually stop. And this analogy of marching is important because what we are taught in our climate especially, and I think you might have similar, is that this rest, it's actually forcing or ordering that you sit down, you unlace your shoes, and you take off your socks and you air them, because otherwise you will have blisters. And if you just continue to march And then maybe you think, oh, I'm warmed up. I'm going. I might just continue. You will definitely get those blisters. And we know that if you have those blisters, you will, even if you put a Band-Aid on or you take a longer rest, you will most probably, again, you have thin skin on that sore that you have built up. So the beauty of this is that you have to order march, rest, because that's how you will reach your goal quicker and fast, and you will be able to go longer for a longer period. And also it goes back to the principles of creating clarity. What's the objective? You understand what's being asked of you, and you can also increase a sense of control. So these are some of the things in the toolbox. And I think maybe we should stop there, but it's an idea. And again, when we have this toolbox, it's very much based on creating that idea of where are we going? Can we have a common understanding of where it is? So we understand when to use these and how we can latch on to what we already are doing.
Lena, thank you very much. Yeah, we're just doing a time check because